Assalamu alaikum. Today we are going to present a case of traumatic cataract. Get ready for a surprise. A few days back, a male patient came to me. He is a one-eyed person. In the right eye, he had a central corneal scar with adherent glaucoma, and he has been using atropine drop for last 8 years to see. Now he has developed cataract and vision becomes less than 660. So this is the scenario of this patient. After dilatation of the pupil, he can see something. So we plan to do a phacoemulsification surgery along with pupilloplasty under a systemic steroid coverage. So here we did a regular phaco surgery, and as the pupil was fairly dilated, so I didn't go for iris hoop to reduce the manipulation. We did a continuous curvilinear capsulorhexis, and then regular hydrodissection was done. Hydronucleus rotation was done. Here I have used the modified stop and chop method for the nucleus removal. Up to this stage I was comfortable, but as I was removing the nucleus, the pupil becomes very small. So I use a bimanual cortex removal method, and I was having trouble in the visibility due to the corneal scar. So after removal of the cortical matter, we decided to implant the posterior chamber intraocular lens, and we implanted the IOL. So after the implantation, IOL was rotated and it was placed in the posterior chamber. After that, I have proceeded to do the remaining removal of the cortical matter and pupilloplasty so that light can enter into the eye after the surgery and the patient can see without atropine. So here I have used micro forceps and scissor to do a pupilloplasty. So after completing the surgery, I was very happy, and my mind was. But in the first POD, things weren't as I expected. Visual acuity was just perception of light, and there was a dense white membrane behind the lens. My DD was endophthalmitis or maybe a cortical matter. So I was in complete silence. After an extensive consultation with vitreoretina and uvea specialist and vigorous treatment, the cornea becomes a little bit clearer, and we did B-scan all the investigation and confirmed that it was not endophthalmitis, and there was a huge cortical matter came just behind the lens, and it occurred because the poor pupillary dilatation. So now we have planned whether we have to go for YAG laser or anterior approach removal of the cortical matter, or we can go through posterior approach. So when the eye becomes quiet, we go for a second surgery and just remove the cortical matter with an anterior approach. And we do a stromal hydration, and the final visual outcome was 618.